Hi, everyone. Welcome back to the Nuance Needed podcast. I'm Amanda.
And this is Sam.
And
this is our radio show. If you're not watching clips of this, we're both sitting behind a desk. We're at Amanda's house today recording.
Yes.
And she has the whole fancy getup, and I'm on this little side desk with the microphone, and it very much feels like we're channeling our inner Delilah.
Yeah. It's fun.
And it's great. So
normally I feel like when we're at your house, I feel more professional, but
that is so wild to me.
This feels like I'm at a college, and I'm a college.
It's an internship.
Yes.
We're on the internship today.
Yeah.
See, that I feel the exact opposite because her background is so much nicer than mine, than what we have here. It's very professional feeling.
Today, we are going to wade into the controversial waters of self-diagnosis, what we think about it, the pros and cons of it, and a way to help you kind of understand why we have concerns about self-diagnosis. Specifically, I would say, right, self-diagnosis has risen to be a lot more of a thing since COVID, since TikTok diagnosing, since I feel like what really kicked it off when I think about it is going back to like TikTok and therapists and other people being like, here are like 5 signs that you have trauma, or sneaky hidden signs that you have ADHD, with the pointing and the dancing.
Yeah. 3 signs that you are on the spectrum.
Yes. Or like these signs are super sneaky and hidden. And they're like, do you know what else it's like? It's kind of like a horoscope.
Oh.
Where it is specific but general enough that everyone does it. Where it's like a hidden sign you have ADHD is you're forgetful. You forget your keys. You forget the names of people that you just met.
It feels like you're ascribing a personality more than you are like a diagnosis.
Yeah, and it's a really niche thing that makes you feel really like, oh, this is me. But it's also really broad that a lot of people can relate to forgetting people's names when they first meet them.
Yeah. Or like losing your keys.
Yeah. And being forgetful, right, doesn't mean you have ADHD necessarily.
No.
But
and we will get into
that. So.
Yeah. Everybody wants to feel seen. And I think the other thing that is like the most common human response in the world is you want to feel understood. And you want to feel that the experiences that you're having and the things that you're struggling with have a reason.
Yeah.
That goes just beyond like, I'm having a bad day. And so I think that is why so many of those posts for so long were so attractive to people and had so much engagement and a lot of traction, was because they made sense.
Yeah.
And the hard thing is, this is where it's going to get dicey.
Yeah.
They're not technically wrong. I do think it went too far. Like there were some where it was like, are you chewing on your fingernails after lunch? Like that means you have,
horoscopy
anxiety. Yeah. Yeah. However, and I've gotten in like other podcasts that I've been on, I've gotten some very serious pushback where people are saying, I'm trying to say diagnoses don't exist or that people aren't allowed to diagnose themselves. And that is not true. That's not what we're saying here.
Yeah.
I, with clients multiple times, have literally whipped out the DSM, the Diagnostic Statistical Manual, flipped open the diagnosis, and we go through the symptoms together.
Yep.
And we talk about it and we explain it and we work through it. Like diagnosis is very real. Yeah. Amanda and I have no professional reason to be here if we don't think that's true.
Yeah.
And I think people have become a little bit carried away.
And I think, to your point, right, it feels good to have a name for something. And for some people, getting diagnosed with something or finding the name of something is like a huge relief because it can help you understand yourself better, understand the world, understand how to even get information, right? Like I think that for a lot of people, when they don't know what's going on or why, like for the many people who do have ADHD, figuring out you have ADHD is life-changing.
Mhm.
Even if you don't have medication, right? Like just understanding yourself, understanding that there's a reason, why you get overwhelmed or why you get fatigued or how to take breaks or things like that can be incredibly empowering. And I think the hard part of it, that's why this has so much nuance to it, is that it can also, right, for some people, getting a diagnosis is a huge relief.
Mhm.
For some people, getting a diagnosis,
Feels devastating.
yeah, it's devastating. It's, especially people who've been in and out of therapy a ton, in and out of like treatment. People collect diagnoses from professionals even,
Mhm.
right? Like
Mhm.
charms. I mean, I remember when I worked at a rehab, people would come in and they would have like 5 diagnoses, and it would be like, guys, this person is addicted to drugs.
They don't have bipolar.
No, they're probably not borderline. They probably act really manipulative and feel suicidal because they're like withdrawing from drugs, and their family, they don't have relationships with their family. So it's a big spectrum. I also have gotten pushback on it. I was on Kate Kennedy's podcast in 2021, actually, which is a long time ago. And people were very frustrated with me, but I think there's a lot of nuance, and that's what we're kind of asking for you to consider. And if this is a spicy topic for you or something where you don't feel like it's helpful for you to hear it, please move along. That's totally fine.
You don't have to listen to this.
You don't have to.
But we wanted to give perspective outside of just the hot take. Because I think when we were thinking of having this conversation, what I was thinking to myself is I do think sometimes I have fallen victim myself in some of these other podcasts and interviews that I've done with like the hot take vibe of like, you're wrong if you self-diagnose. Bye. And there hasn't been a ton of like extrapolation on why that is a problem.
Yeah.
And problem maybe isn't even the right word.
Pros and cons. There are good things about it. It helps a lot of people.
Yeah.
And as we've seen this expand rapidly, and we've seen how different diagnoses become trendy, it makes people a lot of people feel really overwhelmed and feel like, oh my God, I have 10 different diagnoses and there's something wrong with me. And I get it. Like when I was in, there's like a joke that I think is helpful for people to know. Everyone who gets trained in therapy, there's always a joke in grad school that you will think you're when you start learning about diagnoses in the DSM, everyone thinks that they have all the diagnoses. And that is a real thing because some of these symptoms, many of the symptoms all overlap and look differently. And I think what's really hard that's important to understand about we're trying to quantify unquantifiable things a lot of times in mental health. It is not like cancer or something else where you have physical evidence of what's happening. You're trying to collect a group of symptoms that interact in a specific way that are different enough from other symptoms that are long enough and categorize it as a specific thing.
And you're also keeping in mind that there are situational elements to life. It is normal to feel like getting out of bed is impossible when you are in the throes of grief.
Yes.
It is normal to feel deep anxiety when you're in the middle of a huge transition, like a big move, or you've changed jobs, or you've just ended a relationship and you're living on your own for the first time. Like we're kind of all coming together with all of this just to say, if I could like sum it up in a line or two, the issue that I have with the rise of self-diagnosis and the rise of discussion around symptoms and symptomology is that, like any topic on social media, you cannot possibly address the nuance and the reality of every individual situation. So someone could see a list of 3 to 5 symptoms and feel like they've had their whole life explained to them and it makes sense.
Yep.
But the problem is they're leaving out a bunch of different circumstantial pieces that might mean that they're having those experiences, they're experiencing those behaviors, engaging in that way, but they don't really have it.
Yes.
Because of their life. And so I feel guilty too, because in the beginning when I was building my page, I definitely posted some of those videos. I did some of like if you have anxiety, you have this, 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 and this. And they got a ton of traction. People loved him.
Yeah. I think a really good example that illustrates this point, Sam, is, for example, in the DSM, there is a difference between PTSD and
Yes.
acute stress disorder.
Mm-hmm.
And they are the same symptoms, but what differentiates them is how long the symptoms last.
Mm.
Like, I think it's 4 weeks if it goes beyond that.
Yeah.
So if it goes beyond that, it's PTSD. If it's less than that, it's acute stress disorder. They're the exact same thing. People can have both because one can become another, essentially. But the problem, right, with this is again, we're trying to quantify the unquantifiable.
Yep.
Is someone who has it on day 29 versus 30, all of that different? It's really hard to know. So we have to just, like, that is the other problem, I think, with self-diagnosis that isn't talked about enough, is like the DSM is also not perfect at all.
No.
So we're not saying like the DSM is right and diagnoses are right and you're wrong either, or someone else is wrong. We're trying to quantify the unquantifiable that is nuanced, and it's very related to culture. Like every, few years when the DSM is redone, it changes a little bit and they try to make it better every time, essentially. Like I know this in this last update, they've made more spectrums for things. That was really great and important. But yeah, so this is the nuances. We don't love the DSM, but the DSM is the best and really only tool we have. And people overdiagnose themselves and are underdiagnosed.
It's really messy. And I don't know. Have you had clients coming to you being like, "Oh, I was on TikTok and I realized I have autism"?
Yeah, I don't even know anymore if people really say TikTok anymore as much as just like people come in with a diagnosis, which like, it's just so interesting how our jobs, I feel like, have changed so much from rather than people used to be very afraid and dislike diagnoses. Some people still are. And now it feels like people come in with diagnoses and our job is, rather than kind of telling people and educating people, it's like re-educating people through all of the misinformation.
As Amanda and I have like spoken about this separately through different channels and outlets, and as we've like spoken about it together, we didn't realize we were like missing this term in the explanation of it. And it's a term that we know, obviously we learned about it in school and it was driven home to us in our training and our supervision and internships and all that. But it's kind of clunky and like really academic and like sanitized sounding. And so it's not something you're just going to like whip out in casual conversation. Yeah. So the terminology is differential diagnosis. Differential diagnosis, put very casually, is someone comes to you with a set of symptoms that feel concerning to them or symptoms that are causing them distress in some form. And you start all the way at the top of the funnel.
Yeah.
And you recognize that there are a lot of different diagnoses that could fit the description of those symptoms.
Yeah, like if someone comes in and they're like, I feel really forgetful and I feel like I can't remember anything and I feel really scatterbrained, there are probably 50 to 100 diagnoses that could be, because a diagnosis isn't just one symptom. It's a collection of symptoms within a specific period of time within a specific context.
Causing extreme duress, depending on the diagnosis, and impacting your ability to function day to day.
Yeah.
And that is happening every day.
Yeah.
So, for example, if someone comes and says, I feel so anxious, especially if a woman is coming to me saying that, my first question is, are you on your period? Do we have a concern of PMDD? Do we have a concern of anxiety? Do we have a concern of depression? Is it all wrapped in together? Is ADHD present and it's highlighting some of these hormonal differences? Like, so you start at the very top of that funnel.
Yeah. Trauma, life circumstances.
Absolutely.
Are you eating well? Are you sleeping well?
Do you get outside? Do you move? Do you have a stable job? Do you have healthy relationships? Yeah. You start asking all of those questions and you start to filter things out as you go through the funnel. Yeah. And so the hope is eventually you get to some type of a bottom and you are able to identify, okay, yeah, this fits, or actually maybe it doesn't. Like it makes sense that you're experiencing some of these things based on what's happening in your life right now. And I would say as a therapist, more often than not, when you get to the bottom of the funnel, a lot of it is situational. Yeah. Or the if it's anxiety, right? They actually have mild anxiety that is being exacerbated by life circumstances, or mild depression that is feeling exacerbated by life circumstances. With all of that said, the reason I got into the explanation is because I hope that colors how just seeing a post on social media that has 3 to 5 symptoms listed on it, or seeing a caption that has these little blurbs displaying it, like explaining these different symptoms, that you would understand that is like that's behind the starting line.
Yeah. Well, a lot of times too, the symptoms they list aren't even official symptoms either, right? Like
they're like traits.
Yeah. Yeah, that's a good point. But also, like, if I'm going back to like the example we used about like, right, like forgetting someone's name when you first meet them is not a symptom of ADHD.
Right.
Forgetfulness might be.
Yeah.
Nothing takes away the pain of being human. And I think we're searching so desperately sometimes for answers. We forget that, yeah, if your like, we talked about this a little bit when Chelsea Fagan came on the episode or the podcast, right? Like if you are struggling to put food on the table, to afford your life, to have, if you're a parent and you're struggling to make ends meet, care for your child, if your needs aren't met, it is a normal response to that to have your mental health suffer.
Yeah, those are things that are inherently stressful at a baseline.
Yeah.
And so a big question that I have when I have clients come to me and they're talking about things that are feeling overwhelming too much, feeling like they can't handle things, we start to break down the situational elements to it. And I start to say like, well, if that wasn't there, do you feel like you would still feel this way?
Yeah.
And honestly, what's the most concerning to me is when I have a client come to me and they do have the stable job, they do have a stable relationship, they do have stable financial situation, like everything is technically good and they're still struggling with this. That's a sign to me of like, okay, there could be something deeper here, that maybe we need meds and combination therapy, right? Like there's all sorts of nuance and layers to this.
Yeah.
And it's a double-edged sword for me too as a professional, because I'm so glad that we're speaking about these things so openly now.
Yeah.
And that it's not a stigma to say I struggle with depression or I struggle with anxiety, or getting into the more impactful diagnoses like bipolar, personality disorders, addiction, all of that. Like there's less stigma around it, which is wonderful because people can feel now that they have the information they need to go get help. My concern is that I think sometimes any movement forward stops after the information collection phase.
Yeah.
And it's just like, oh, I've seen this. My FYP is serving me every video known to man on this. Every single video fits. Thus, this is what it is. So I have it and it's done.
Well, I think that is the really difficult part of this too, is that especially with the introduction of TikTok, because Instagram used to be very different than TikTok. They're a little more similar now with you get served a lot more content. You used to really be able to curate your feed on Instagram. Yeah. So I think that is one of the really hard things, is you can go down rabbit holes much, much easier, where if you watch a video and like it about, right, like generalized anxiety disorder, let's say, you're going to keep being served that content more and more and more. And a lot of times it's like more extreme takes of
and
it.
Like it's the level of specificity to some of like the symptoms that they're talking about. And I get it. Sometimes it fits. But I think I worry about the distress that this sometimes causes people, the feeling that they need to like rearrange their identities now that they think this is who they are and it defines their whole life. I get really wary of the level of stress and pressure that people put on themselves when they see some of these videos, and that they're taking on all of this ownership for things that maybe actually aren't that. But then they become very defensive when they feel that they now are that, and they have these answers and this thing that makes sense. And then it's like, well, don't question me. And I'm like, I'm not questioning you. I absolutely believe that you identify with this. You're experiencing this. This is your truth. I just want to make sure we're at the bottom of what's really going on here so that you can know how to help yourself.
Yeah.
And what to do.
Yeah. Well, I think too, I want to say one thing and then I'll
Yeah.
kind of respond to what you said.
Yeah.
But right, like I think the other problem, which is very true, is that mental health care is incredibly expensive in this
Yes.
country.
And difficult to get.
It's difficult to get. Insurance doesn't do a good job of reimbursing people and reimbursing therapists. Like the healthcare system is a huge problem. So a lot of times people are desperate and they're like looking for reasons. They're trying to understand themselves. And I completely understand that. And especially if we take it even deeper, like women are often completely disregarded and not listened to about their health at all, whether it's physical symptoms or mental symptoms. So I do have tons of compassion for people who end up diagnosing themselves because a lot of times they do out of lack of being listened to, lack of answers. Like I went down rabbit holes with, like I've talked a little bit about this with my back, and I've had a lot of back pain and since I gave birth 2 years ago, and I went down all kinds of rabbit holes trying to diagnose, do I have thoracic outlet syndrome, do I have bicep tendonitis, do I have hypertonic, right? Like there's 900 different things, and I get the desire when you feel hopeless, when you feel like people don't have answers for you, where you feel like people aren't listening to you, when you need a diagnosis to get insurance reimbursement or get treatment, or you're trying to help yourself and you're trying to have a term to organize yourself around.
Yeah.
Right? Like this is good for if you know, if you have, this is the channel you can follow in the book you can read if you have ADHD versus anxiety versus trauma. So I just want to say that because we are not invalidating the why behind searching. We just also see some of the harm that it causes. And I think we want to be honest about that as well.
I am really, really glad you brought all that up because it's all true. Like that is so real, and the lack of resources available to people. And I think so many of my clients have been coming to me with varying concerns that have somehow ended up in doctors' offices, and the fucking disaster rigmarole it takes to get even like a modicum of an answer.
Yep.
And we absolutely want to hold space for that. And that's something that we talk about as friends. We talk about it all the time in our frustration with it. And I think some people, there is a realm where because they don't have access to the professionals to help make sense of this, they end up taking on a lot of additional stress in feeling concerned that they have these things, that these things are going on, that these things are happening to them when they don't need to.
Yeah.
Because it might not fully fit.
If this conversation is making you think, I could actually really use a therapist, I have great news for you. My practice, Therapy for Women Center, offers therapy in the Philadelphia area and in 43 states across the country. This is also where Sam works. So if you're interested in working with Sam or with me, we sometimes take a limited number of clients every year, and we would love to work with you. Or if we're not a fit, we have, like I said, licensed therapists across the country. Learn more at therapyforwomencenter.com. Yeah, and I think also there has been, because in a lot of populations the stigma does still exist. We've made a ton of progress on it, but I also think what is concerning to us that we've talked about is there is like an identity that can also be formed around certain diagnoses, where it can be, you know, trendy to have certain diagnoses. And I know that is a very controversial thing to say, and that is a normal cultural thing, right? That is what's also really interesting about mental health is that there is, like, if you look back even from the 50s beyond, you know, we talked about this a little bit with Britt's episode with borderline personality disorder, different cultures have different ways that we understand the world and become like mental health sort of diagnoses. And there's a big cultural component to it. And I think women were chronically underdiagnosed with ADHD for an incredibly long time.
Very long time.
Which has caused a lot of millennials, I think, too, to realize that they are struggling with this, and it's been life-changing for them. But I also think that we have to remember the point of a diagnosis is to get the appropriate care and help. And at the end of the day, I don't care, right?
No.
Like obviously a psychiatrist is going to prescribe something different from anxiety versus ADHD, but it doesn't matter to me if someone is coming to me, as long as like we're working through solutions that make sense. Like if you're not hurting yourself or taking a medication that is not prescribed to you or doing something ridiculous, whether you want to call it ADHD, right? Like anxiety with forgetfulness, trauma, whatever word you like, I don't care what word you use. I care about you getting help. I think where we get frustrated and concerned is when people aren't getting individualized care. So they're very stuck on the diagnosis and only doing things based on their diagnosis, and something else could maybe help them if it's like the wrong diagnosis potentially.
Absolutely. It easily becomes so rigid.
Yeah.
And it can, especially if you are someone that struggles with all or nothing thinking or black and white thinking.
Which most people that are struggling with their mental health do. So that's hard.
I do.
Yeah, me too.
That's something that I have to wrestle with a lot. And I think to just keep in mind, adding on to what you said of like, we want to get you the help that you need. This was also, I didn't think that this was going to be a controversial statement, but apparently it was.
Did you say this on Chelsea's YouTube channel?
Where did I say this one? No, I said this on Girls Camp podcast. My goal, exactly what Amanda said. I really don't care what the terminology is. Whether we decide if it's anxiety, it's ADHD, it's depression, it's something, it's trauma, it's whatever. That doesn't matter to me. What I want is for us to be able to have a framework to know how to help you identify the symptoms and behaviors that are causing you distress, discomfort, and pain in your life, and know the modalities that we need to use to help you sort through that. I'm not talking about changing you. I'm not talking about fixing you. I'm not talking about saying there's something inherently wrong with you and you're broken and we need to try to repair you. That is not what we're saying here. What we're talking about is, at the end of the day, really what matters is, okay, so does feeling overwhelmed, having racing thoughts, and having a really negative view of yourself impact your ability to show up in your job the way you want to? Okay, awesome. Let's talk about dealing with that and how we can work through that, right? For ADHD, are the symptoms of ADHD causing you distress? Because you feel like you can't manage your life, you feel like you can't stay on top of things, you feel like you're constantly behind, or that analysis paralysis where you feel you're just stuck, can't move, you're just scrolling on your phone for hours and hours. Okay, is that causing you distress? Let's help. Let's talk about some executive function coaching. Let's figure out what we can do to make it better. And when I talk about helping somebody out in that way, it is your God-given right to decide you are completely fine with everything as it is, and you don't want anything to change. Godspeed. I wish you the best. Truly. And there's plenty of people that do that. There are plenty of people that have ADHD and don't take medication because they found a way to manage it on their own and they're okay. Or it doesn't bother them. And that is okay too. I have no problem with that. But when someone comes to me and says, I feel very overwhelmed and flooded and stuck, that is a red flag to me that there is something that we can do to try to make this better. And I think that is what gets lost in the sauce. And kind of going back to what you said about people feeling it becomes an identity a bit, is if you take on something as an identity, you can feel incredibly defensive when someone tells you like, hey, but what about this? And I think with the social media disaster information flood that we're constantly being fed, that can easily become that way. But also, I think something that is helpful about social media is it can make you feel less alone. If you see how many people are actually going through this and how many people are struggling with it, that can feel incredibly empowering to realize like, wow, like I have this group of people that do the same things I do. I thought I was the only one. Nobody else in my life ever did. And so that makes me excited for people to feel seen for the first time in their life. Yet they don't have to, if they are feeling uncomfortable with some of those symptoms, if they are feeling overwhelmed by it, they don't have to just live in that space for forever simply because they've realized they recognize this diagnosis in themselves and they've found this community and they realize this is something in their life.
Right.
Like that, this is the layers to all of this that is representative of just like a simple video
Yeah.
that has like 3 bullet points attached to it.
Yeah. Yeah, absolutely. And I think it is hard because I think the more you feel misunderstood, discounted, invalidated, the more it is important for you to have that diagnosis and the more defensive you are going to feel of that diagnosis. And I completely get that.
Yeah.
And I think it's hard because when you feel like, you know, no one's believed you for so long and you have an answer, you are going to want to hold on really tight to that answer. And it makes complete sense. It's logical. And I think we all, as we become more polarized, as we curate our feeds more and really aren't exposed to the same things, we're losing the ability to be exposed to different information or people that don't 100% agree with us or people that give a different opinion than us without losing ourselves. Because if you never, right? Like, and we're really excited. We have an episode coming out soon with a misinformation expert who we talk about this a lot more with.
Yeah.
But like a huge part of his work and his point is the more you actually expose yourself to different viewpoints, it's good for you because you're more rooted in what you believe, even if you feel temporarily like you're like losing yourself, kind of
shaken up by it or uncertain. It helps your brain in the long run,
but it's hard in the moment, and we struggle with it too.
Yeah, this is hard for us too. But I think, again, the whole point of this podcast is for us to be able to kind of model talking about the complexity of all of this.
Yeah.
And part of why we decided we really need to we needed just an episode to just kind of like let it all flow out is because people have been so reactive to us when we've said these things in like a public setting. Now, I think there's some people that just, they're trolls and they want to be mad and they're going to be mad.
Yeah.
But I think my biggest bit with all of this is what I would love for people to be able to practice, and I think this goes like for a lot of topics, is the concept of curiosity, which is the exact opposite of black and white, all or nothing thinking.
Yeah.
Which is if you see something that you feel you relate to, or you see something that makes sense to you.
Or something you hate, maybe too.
Yeah. Yeah. Something that you're like, what the fuck? Like, which happens to me every day that I get online. So I'm practicing this with you. I'm holding your hand. We're doing it together. For you to, instead of approaching it with trying to shove something into a binary or trying to force something to fit a narrative, or feeling that because you've seen it and you relate to it, you have to immediately adopt it, to get curious about it.
Yeah.
To think about it, spend some time with it, to spend some time analyzing, why did I relate to that? Or why did that make me upset? Or why do I care about that? Like, it's, I guess maybe really what we're talking about here is like ways to combat the anti-intellectualism that's on the rise. Like, intellectualism gets a really bad rap when really intellectualism is just about thinking and comprehending and holding space for and like making sure that something aligns with you. And if something challenges a belief that you had, or if something makes you think of something differently, to not immediately villainize it, but instead to say, wow, why did I have a reaction to that in the first place? Like, why would I feel attached to that? Why would I feel so repulsed by that? You know, and obviously there's some things that are like very straightforward. And I'm not saying you have to like apply this to watching like a video of someone making cookies, but like to think of this diagnosis stuff specifically, to be able to look at it and be like, ooh, wait a minute. I identify with that. That's interesting.
Yeah.
How am I seeing these things in my life? When am I seeing these things come up in my life? And allowing yourself space to explore it without feeling the need to immediately be like, oh my God, this is me.
Yeah, this is my identity.
This is my identity. This is me in my entirety. This is all who I am. End of story.
Yeah. I think that's a good point. Yeah. Like, we can hold things without absorbing them. And I think that's one thing that takes practice that maybe we've gotten out of the practice of doing. And they're just like we talk, like literally differential diagnoses in a nutshell is the ability to hold multiple things could fit this one thing.
Yes.
It is allowing literally the idea that multiple things can exist at once. So I think it's a really good framework for sort of like the current living your life online. And we talk a lot about how to, allow more nuance in your life. And I think like a puzzle, sometimes it's very silly because my daughter does these like fairly simple puzzles because she's 2, but like there are different ways sometimes to do the same puzzle because if you put 2 triangles together, they can make a diamond, right? If you
in different directions.
if you do different things, it looks differently. And I think that is why having someone who's trained in it is valuable. It doesn't mean you need someone, because also if you're not interested in medication or therapy,
go with God.
Go try different things, and that's great.
Yeah.
Or if you can't afford it or it's not accessible to you, absolutely. But I think maybe even if you feel like this makes sense and you want to, you feel like this is absolutely true and this is your diagnosis, maybe just leaving room, like you said, for curiosity that maybe there could be something else going on as well. Maybe something else is even making it worse. Maybe your situation is making it worse.
And I will say, like, my clients have been wonderful in that they've come to me with like very curious attitudes, which is what I really respect, is that they show up and they're like, hey, like I saw this and this, I think I have this.
Yeah.
And if someone has come to me and said, I have this, I look through their paperwork, be like, oh, okay, they've met with a psychiatrist or they've met with somebody before and they've sorted through it. But if I have a first-time client that's never worked with anybody before and they come to me and say, I have this, I'm like, oh, why?
Well, we have to do our due diligence.
I have to ask questions to make sure I'm understanding the history to know what space that we're working from. Because my strategy is going to be completely different with somebody who has seen a therapist or 2 before compared to someone that's never been. And again, it's like allowing space to explore and be curious. And like, I don't make assumptions off of anybody's paperwork, period. Or even off of our first session or a 10th session. Like that's the whole point. And I think what I would hope that creates in people as a feeling is a sense of relief that any good, decent therapist is going to be constantly assessing and not in a way of assessing for like, what's wrong? Is something wrong? But assessing for, is this working? How are they doing? What, they come in saying this, and this is the problem, but actually they're focusing a lot more on this, and this. So how are we talking about those things? And to apply that to you, dear listener, to your day-to-day life, to allow yourself to be constantly assessing yourself. I am not saying to be perseverative. Okay. Let's stress that. But if you are noticing that you're going through a period of time where you feel more stressed, you feel more anxious, pause, take a moment and look at like, what is happening in your life? Is there a lot going on? Are you too busy? Do you need to be better at managing your schedule? Do you need to chat with your partner about getting more support? Do you need to figure some things out there? Like, even if you are experiencing some of these symptoms and some of these things, allow yourself to think back on it and be like, if I remove some of these stressors or issues, do these symptoms alleviate themselves? Or, I can go like all the way back in my life and realize this has been like a feature of mine for forever. Okay. Those are 2 different situations. Neither one is good, bad, right, wrong. They just are. But it allows you to be specific about you and not take on what anybody else's experience is or what anybody else is telling you that it has to be, but for you to like develop the narrative of your own experience.
Yeah, absolutely. We hope that you enjoyed this episode.
And as always, anything that you can do to get the word out, we appreciate, so that we could continue to meet in this lovely setup and maybe upgrade one day. Maybe. So if you could rate, review, subscribe, share, it means the world to us. We read all of your reviews. We love every single one of them. They mean the world to us. And we think you're the best, and we'll see you next time.
Yep. Bye.
Bye.